Have you ever stared at the ceiling at 3 a.m., tired, frustrated, begging your mind to turn off, but it won't? You're not alone. Millions of people around the world struggle every night to fall asleep or stay asleep. This condition has a name, insomnia, and it's more common, more damaging, and more treatable than most people realize. In this video, let's talk about what insomnia really is, what causes it, how it affects your brain and body, and most importantly, how to fix it. What is insomnia? Insomnia isn't just a bad night here and there. It's a consistent difficulty falling asleep, staying asleep, or waking up too early and not being able to go back to sleep, even when you have the chance to sleep. It's diagnosed when it occurs at least 3 nights a week for 3 months or more and causes problems in your daily life, like fatigue, low energy, poor concentration, or mood issues. There are 2 main types: acute insomnia, short-term, often triggered by stress or life events; chronic insomnia, long-term, often caused by deeper mental, physical, or lifestyle factors. How insomnia feels: people with insomnia often say things like, "I'm exhausted but wired. My body is tired but my mind won't stop. I wake up at 2 a.m. and can't fall back asleep. I dread bedtime." Insomnia creates a cycle. The more you try to sleep, the harder it becomes. You start fearing the night. Your bed becomes a source of stress. It's not just in your head, it's real, and it has real effects. What causes insomnia? There isn't one single cause. It's often a combination of stress and anxiety, depression, or mental health disorders. Poor sleep habits, like screen time before bed, caffeine, alcohol or smoking shift work, or jet lag, chronic pain or medical issues, overthinking about sleep itself. Sometimes insomnia starts with a life event, grief, divorce, exams, and then becomes a learned behavior. How insomnia affects your body and mind. Lack of sleep isn't just annoying, it's toxic to your brain and body. Your memory gets worse, your emotions become unstable, leading to irritability or depression. Your immune system weakens, you feel constant fatigue and low motivation. Over time, insomnia raises the risk of heart disease, diabetes, and even Alzheimer's. Sleep is not a luxury, it's as essential as food, water, and air. When to see a doctor? If your sleep problems are interfering with your daily life and have lasted for weeks or months, it's time to talk to a professional. Sleep disorders like sleep apnea, restless leg syndrome, or delayed sleep phase syndrome can also look like insomnia but need different treatments. A sleep specialist might recommend a sleep study or assess your mental health, medication use, and lifestyle. How to beat insomnia? Naturally. Here are science-backed tips that work better than pills for most people. 1. Cognitive behavioral therapy for insomnia, CBTI. This is the gold standard treatment. It teaches you how to control racing thoughts, rebuild a positive association with your bed, reset your sleep-wake cycle. Many people improve in just 6 to 8 sessions with long-lasting results. 2. Sleep hygiene tips. Go to bed and wake up at the same time every day. Keep your room cool, dark, and quiet. Avoid screens, caffeine, alcohol, and heavy meals before bed. Reserve your bed only for sleep and intimacy. Don't nap during the day. The 15-minute rule. If you can't fall asleep in 15-20 minutes, get out of bed. Do something relaxing in another room. Only go back when you feel sleepy. Lying in bed wide awake trains your brain to associate the bed with wakefulness. Break the loop. What about sleeping pills? Sleeping pills like benzodiazepines, Z-drugs like Ambien, or antihistamines may help in the short term, but they're not a cure. They can cause tolerance, dependence, and next-day drowsiness. They don't provide natural sleep, just sedation. They don't fix the root cause. Use them sparingly, under supervision. Better yet, use them as a bridge while building healthy habits or starting therapy. Alternative options that can help: melatonin, works best for jet lag or delayed sleep phase, not chronic insomnia; magnesium or valerian root, mildly helpful but not miracle cures; guided meditation or apps; calm headspace; insight timer, useful for racing thoughts; white noise machines, great for light sleepers or noisy environments. Remember, supplements are tools, not solutions. Insomnia. In different age groups, teens often have delayed sleep cycles and stay up too late. Adults face stress, workload, and screen addiction. Seniors may have lighter sleep, medical issues, or medications affecting sleep. Insomnia is not a normal part of aging. No matter your age, good sleep is possible. Success stories and hope. Many people think they're stuck with insomnia forever, but they're not. With the right mindset, tools, and support, sleep can be retrained. There are thousands of stories of people who went from dreading the night to loving bedtime again, not with pills, but with knowledge and patience. If you've struggled for years, don't give up. You are not broken. Your brain just needs to relearn sleep, and it can. Last but not the least, a peaceful good night. Insomnia doesn't define you. It's a challenge, not a life sentence. You deserve rest, you deserve peace, and you can reclaim your nights. So tonight, try one small step, maybe turning off your phone 30 minutes earlier, dimming the lights, or writing your thoughts down in a notebook. Sleep is a skill, and every night is a new chance to practice. Thank you for watching. Sleep well. You've got this.